So what would be the role of the livestock, of the animal farming? How does it contribute to this resistance of drugs? Our next guest is Chief Veterinary Officer for FAO and has over 30 years of experience in working with veterinary services in various countries. Please welcome Dr. Keith Sumptions.
Thank you very much. It's a great honor to be here, and I very much appreciate this opportunity to speak with you and to listen to questions. Firstly, we really welcome the focus on behavior change, because human behaviors have the greatest impact on all forms of life and the interconnectedness of animal, human, and planetary health. There are tremendous challenges in our field, and they have been indicated, some of them before. Food systems have been rapidly changing. Where we live has been changing, what we buy and our trends, and the food and agriculture value chains have been adapting in some respects to try to make them more even and uniform, at the same time more globalized as a result. These produce a number of trends within our sectors, including greater intensification for the aim of supplying those value chains, but also some potential for risks associated with those. In terms of our challenges, we recognize that there is a very, very significant consumption internationally. And in the first survey that was of its field in livestock a few years ago, we recognized the total amount, plus the fact that it is expected to rise significantly. We are talking about a really quite enormous business of the value chain of medicines themselves. The global animal medicine market is estimated at around 42 billion in 2019 and is expected to grow to around 85 billion in 2030. Of that, around 88% of sales are estimated to be veterinary medicines themselves, with growth promoters around 12%. And internationally, North America is the largest of those markets, but the markets are growing rapidly in other parts of the world. In terms of the trends, the OIE has been reporting on the use of antimicrobials in animals, and the trend, although encouraging to some extent in terms of the decreased number or proportion of countries using growth promoters, there is still a very significant amount of use of highest priority, critically important antimicrobials, around 25% of the total AMU use in animals. In terms of the global trends in the development of AMR, the concern here is that there is a rising proportion of resistance in a number of regions, and particularly in the more intensified sectors of animal production. In terms of our opportunities, as mentioned before, the Global Action Plan and its implementation through a One Health approach across all of the UN organizations and with the OIE presents a potential for progress. But for that, we need strong political will, and we need greater stakeholder partnerships for better implementation. As mentioned by the previous speaker, the three structures being set up to assist this: the Global Leaders Group to advocate and advise, the independent panel on evidence to assess the options for interventions, and last but very much not the least of these, a multi-stakeholder partnership platform to develop and implement a shared global vision. These three, if working together and working to their extent that they are able, could make a very significant difference, particularly in terms of developing a common vision driven by stakeholders from public, private, and civil society. As part of this, and as an extension, there are the other networks that exist play a vital role. For example, in terms of behavior change and its potential for moving and nudging behaviors that are important and will reduce the need for antimicrobials. And bringing into this spectrum those who may be to some extent left behind but are central. Paraprofessionals play a role in the supply chain for antimicrobials of the widest sort, from plant protection compounds through to parasiticides, through to antimicrobials. More than 1 million veterinary paraprofessionals working in Africa and Asia, almost no in-service training for them after their initial graduation, but they have a key role, a key interface with livestock keepers. Now, in this setting, the behaviors of both people in this picture will be significant. Those who are asking for support and service, asking for advice, and those who are giving the service. Each of these have a role to play, and behaviors in both sides could be affected and effective at achieving behavior change. We mustn't forget in this that one of the major drivers for antimicrobial use are diseases which could be prevented by vaccination in animals. The total amount of antimicrobial and other veterinary medicine sales that I mentioned earlier, of this, vaccines are really not a very high proportion, particularly not in lower and middle income countries. And very little of this expenditure is by the state. So we have a very significant problem with vaccine preventable diseases. If they were prevented, one of the drivers for antimicrobial use would be eliminated. So we do need to connect the agenda for control of those animal diseases by themselves, together with the agenda for reducing antimicrobial use and resistance. So how do we change things? Well, a number of behaviors need to change, and this meeting is a very welcome part of this for us all. FAO is applying the behavior change approach in its countries where it's working. Currently, we've been working with around 46 countries to assist them with their national action plans, and the Multi-Partner Trust Fund, and we must thank Sweden as for being one of the contributors to this fund, has been significant to achieve One Health multi-sectoral national action plan progress in a number of countries. As we move forward, we recognize that behavior change must occur on each of the 5 main axes of our global action plan, and we intend to apply that through our work in these areas which are mentioned here. On the first of those major areas, awareness and engagement, the type of behavior change that we're trying to achieve does depend on good communication products. It does involve the national celebrations and the national efforts at communication, but it's also very much about mobilizing opinion and mobilizing actors who are in the supply chain, understanding their contribution. We believe behavior change in surveillance is also one of the things that we can utilize to make a greater impact for the involvement of farmer field schools in the collection of samples, but also to bring a greater integration of effort to understand the risks and also understand the results of surveillance at the local level. Good practices and responsible use. There's so much that we have started to do in this area, but it needs really to be extended very significantly. Nudging and moving behaviors towards responsible use, reducing infection pressure, the understanding what it is that you are buying and what you are prescribing, and understanding how we can engage public opinion in the buying practice as well as in the supplying practice. Behavior change also in the area of the One Health and legislation, where we need to consider the relevance and the appropriateness of legislation at country level to control antimicrobial sales and to ensure responsible use. Putting it together at country level, we do have a management pathway to assist in the major 4 axes, from awareness through to good practice and evidence, and this has been useful for countries to benchmark their progress. How do we measure what we do? FAO is concerned to see what impact its own work has been in terms of the moving the national action plans forward, and does have an indicator now based on country responses in the tracks system to be able to gauge whether we're making a difference to their national action plans. So, one of the other behaviours, perhaps, that between us all as partners, we're trying to move on to some extent of each of the major partners working together. But now we have trying to develop the culture in which the funders of AMR work fund intersectoral work between us, and using multi-partner funds, multi-partner programs to ensure at country level we have got a joined up way of supporting countries in their national action plans. Finally, in my conclusion, changing behaviours in a growing part of animal health care with a total sales of in the billions is extremely challenging. Almost all of those sales go via the private sector, both in terms of purchasing, but also in supply. So we are influencing, or needing to influence, a major part of a value chain, and in which a lot of actors already have a stake. Resistance to antimicrobials is also a growing issue in maintaining livestock. We do have areas of the world in which the resistance, perhaps more in terms of parasite resistance, is making livestock keeping increasingly difficult. So it's much more than simply a concern for the human health threat, which is the major driver, but it's also a concern for our own area for animal welfare and productivity. Working with value chain actors is going to be essential if we're going to make any progress in these areas. Changing behavior in terms of the buyer as well as the prescriber supplier is part of that. And the tripartite, the partnership platform, as mentioned earlier, could be a key to develop a vision, ambition, and targets in which each of the private, civil society, and public sector interests will come together to make a new vision, ambition, and perhaps targets that we would not dream of as a UN organization, but perhaps driven by our stakeholders, we may be able to achieve more. Thank you for your attention.
And thank you, Dr. Keith Sumption from the FAO.